Hi, I'm Burzeen Karanjawala with Sacramento Colon and Rectal Surgery Medical Group here in Sacramento, California. And today I just want to talk to you about hemorrhoids. This is a very common problem that we see. So I want to talk with you about what hemorrhoids are and talk with you about how they develop and how we can treat them. So first, I want to tell you, all of us are born with hemorrhoids. These are normal blood vessels that we all have in this area. And but sometimes they can start to bother us. And they can become enlarged, they can become painful, they can become irritating, and they can bleed. So most patients, when they come to me or one of my partners complaining about hemorrhoids, they're usually talking about either having bleeding or noticing something swollen there. Sometimes they feel like something pops out when they go to the bathroom, and either they feel it go back in or they feel like they have to push it back in. And other times they will come to us and say, I have this really painful hard lump. And that's a specific type of hemorrhoid that we will talk about. What I like to liken hemorrhoids to, it's almost like they're varicose veins that we end up having in our legs. We all have veins in our legs, but they only bother us when they get swollen with blood. And then that's when they can become painful. What are some of the common causes of hemorrhoids? The common things that we see and that other colorectal surgeons see is that sometimes people are having issues with their bowel movements. Either they're having chronic constipation issues or they're having chronic diarrhea issues. Another problem that sometimes goes in hand with that is that they're straining or they're sitting on the toilet for a long time. All of these things can contribute to hemorrhoids. Diet can contribute to it. Sometimes as we get older, the hemorrhoids get bigger and more bothersome for us. Sometimes it can be seen among family members, and it can be, some people think that it might be hereditary. Now, what can we do for hemorrhoids? So when I see patients, I want to get a sense of what their bowel habits are like and what their diet is like. I want to make sure that they're eating plenty of fruits and vegetables and eating whole grains and getting about 20, 25, even 30 grams of fiber a day in their diet. I also want to make sure that they're drinking plenty of water. Water is very important for our digestion and also very important in order to keep the stool soft. The other thing I want to know is, are they having any issues with diarrhea, constipation? Are they straining? And are they sitting on the toilet for a long time? And when I ask my patients, are you sitting on the toilet for a long time? In my mind, I'm thinking, something more than 5 minutes. Usually it's best to avoid sitting on the toilet for more than 5 minutes. When you sit there for a long time, the hemorrhoids tend to swell up with blood, and that can be a precursor to them bleeding when you're having a bowel movement. So the first step in treatment of hemorrhoids is focusing on these issues, focusing on the diet and focusing on your habits when trying to have a bowel movement. Then, if this isn't working, we have other treatment options as well, depending on how severe the hemorrhoids are. If the hemorrhoids are small enough and the primary complaint is either the hemorrhoids are popping out, what we call prolapsing hemorrhoids, or that the hemorrhoids are bleeding, many times we can treat that in the office with rubber bands. And what the rubber bands do is choke off the hemorrhoids, and after about a week or 10 days, the hemorrhoids just fall off, and most patients don't even notice it. It's not a very painful procedure, and it's something that most patients just feel a discomfort or a pressure-like sensation. They feel like they have to go to the bathroom for the first couple of days, but after that, they're feeling very good. Some of our patients will schedule appointments with us on a Friday before a weekend off, so they can get the rubber band ligation done, have the weekend to recover, and they're back at work on Monday. Then the other treatment option that we offer would be a surgical hemorrhoidectomy. And what this involves is actually going to surgery cutting the hemorrhoids out and stitching the wounds closed. Now this is very different than rubber band ligation. It's a very painful procedure. I tell all my patients, you're going to hate me for about 3 to 4 weeks. You're going to be thinking about how you're going to hurt me back. So that's something that I always counsel my patients on. It's very important to know up front that it's a painful recovery. But all the patients, when they get out of that painful period, the first 2-3 weeks, they're very happy that they did it because they're not having the issues that they had. We tend these days to do surgical treatment of hemorrhoids for the more severe hemorrhoids, the ones where they're very swollen, they're very large, something that we couldn't really treat in the office, something where patients are bleeding significantly to the point that they've become anemic and maybe even need a blood transfusion. So we reserve that for those patients. Now, earlier I did allude to painful hemorrhoids on the outside of a painful heart pump. That's a thrombosed hemorrhoid. And that happens outside, just underneath the skin. And that's something that in the first few days, we can usually just treat in the office by cutting it out. It leads to a quicker recovery, less pain, and patients are feeling a lot better. After the first few days, thrombosed hemorrhoids tend to start resolving themselves. The pain starts to get less, the swelling gets less. And if you give it a few weeks, they'll go away and they typically won't bother you again. So this is a general overview with respect to hemorrhoids. If you have any questions or concerns, you can always call us at Sacramento Colon and Rectal Surgery Medical Group, and we'd be happy to answer your questions. And if you need a consultation with any of our physicians, we'd be happy to see you. Thank you.